completely out of gift bags because we wanted to. Sorry.
Thank you so much for joining us today as we are engaging in critical conversations in reference to the impact of Voca cuts within the state of Ohio, especially the Northeast region is what we have today with us, and we have the directors and regional directors of the area. So I'm going to ask them to kindly introduce themselves. I'm going to start with Molly Mcmath, and then Molly, you could go ahead and introduce the rest of our guests this morning.
Okay, thanks, Rosa. My name is Molly Mcmath. I am the executive director at Compass, which is the Rape Crisis Center for Tuscarawas, Stark, and Carroll counties. And we are a subsidiary of Goodwill Industries of Greater Cleveland and East Central Ohio. I currently also serve as the Northeast Ohio regional leader here in our state for OESV. And so at Compass, we offer the core services for rape crisis centers, which I'm sure you'll hear all the others share those services as well. And that includes a 24-hour crisis hotline. We have hospital and the justice system advocacy services. So an advocate will go with a survivor to the hospital or to a police interview or to the court hearings. We also have support groups, as well as our prevention services. So we go into schools and we do a lot of work with the K through 12 students on primary prevention of sexual assault. We also have campus advocacy at a number of our local campuses. So we really enjoy working with the college students and just raising awareness on campuses of sexual violence and how to do some preventative measures there on campus as well. So I am going to maybe throw it over to Gina Patterson. Would you like to go next?
Sure. Yes, I'm Gina Patterson, and I am the program director for the Domestic Violence and Rape Crisis Program at 180, and we serve Wayne and Holmes counties. And we have pretty much all of the same types of services that Molly mentioned. We have a 24-hour crisis hotline. We have a 44-bed shelter, and we're a dual program, as I said. So our shelter can take both domestic violence and sexual violence victims. We go into the hospitals when they go for their forensic interviews, and we have volunteer hospital advocates that meet with the victims and provide support and linkage back to us. We have victim advocacy, and we are part of a larger organization that is certified to provide both mental health and addiction treatment. So we're very fortunate that if and when survivors have mental health or substance use issues, we can also provide that treatment in-house. And then we also work with 3 local colleges or universities here doing prevention programming and providing support to their students who have been victimized. And then we have a pretty strong prevention program in the K through 12 schools as well, doing lots of prevention programming there.
Gina, thanks for bringing up the fact that many of us do offer the mental health counseling services, even though that's not necessarily a core service. It's still something that we are so fortunate to be able to offer to our survivors here in Northeast Ohio.
Yes.
Thank you, Gina. Gina Bowers, taking it back to Stark County. Tell us a little bit about your program and what services you offer.
Absolutely. Good morning. I'm Gina Bowers. I'm with the Alliance Rape Crisis Program in Eastern Stark County, Ohio. And we offer a really customizable package of services for survivors based on their unique needs. So we have our 24-hour hotline that we offer, which is answered locally. We also offer the hospital and legal justice advocacy, which we will accompany survivors to wherever they need to go. We will be there with them. We also offer individualized counseling that is trauma informed and specialized to their needs. And we also offer community outreach and education. We go and do trainings based on what the community may need. So those are some of our services, and survivors can pick and choose whatever they need for them. And so that's a little bit about what we offer and what we do here in Alliance.
Thank you.
Mm-hmm.
And we also have with us the DV shelter, Kathy. Kathy, go ahead and tell us a little bit about your program and your area.
Morning. I'm in Richland County, and our program is located in Mansfield, Ohio. We are also a dual program. We provide services to both domestic violence and sexual violence survivors. We have a 24-hour crisis hotline like everyone else, and a 30-bed shelter. We've been providing rape crisis services in our area since about 2007. Although even though we were primarily DV initially, we responded to sexual assault survivors whenever they needed our assistance. We're really happy that a few years ago we transitioned our program to dual training our advocates. So our advocates are victim advocates. They respond both to domestic violence and sexual violence survivors versus two separate programs. So that has really helped. That's really helped us a lot. And I think we'll talk about that a little bit later on how we're building some resilience within our workers. We also provide 3 external support groups to areas. One is the pre-release program for our county jail and also for the Volunteers of America. So we're working with those folks. And we also do a support group with a developmental disability program here in our area as well. So those 3 programs are going well. We also work with the Human Trafficking Court in Richland County, so providing support to those folks and to those programs. Yeah, I think that's it for us.
Thank you so much. And that's so important, that building resiliency, right, amongst the services, because you are all very unique in your services, in your areas, even being in the Northeast region, right? And understanding by counties the dynamics, but also the dualities or the multifacets of your agencies as a whole in the max of services that you provide. Camille, you're joining us today. Would you mind introducing yourself as well?
Absolutely. Hi, my name is Camille Prairie. I'm the Director of Legal Services and Public Policy here at the Alliance, and I'm really grateful for the time that all of you are devoting to this in addition to your other responsibilities, especially in the wake of what we're talking about, which is major funding cuts that are affecting the day-to-day services and all of your workloads exponentially. So thank you so much.
Thank you. Thank you so much for joining us. So, as I was mentioning, those dynamics and understanding how different they are and the regions and whether there's colleges and universities, if you're a dual agency, you're offering also counseling services or other type of services. Gina Bowers, Alliance, right? And the services and understanding, you guys had a huge hit. Tell us about the impact of those cuts for Alliance, for your particular programming, and how does that affect the services that you're able to provide at the hospital? How are you overcoming some of those gaps in order for survivors not to be without?
So a few Fridays ago, we all received an email that stated how much our cuts would be from Voca and SVAA funds. And that day we will probably never forget. I was at my computer and I got the email. It said that we received the worst case scenario, which is a catastrophic loss. We lost all of our funding from Voca and SVAA. And that was 2/3 of our funding for the program. So instantly, as I'm trying to scroll through the email and trying to process everything, it just kind of hit me in a small way because I had 3 minutes to process that before I got my next survivor into the office for a counseling session. So I had just a couple moments to digest that and then moved right forward into serving survivors. And that's kind of the I guess, metaphor or basically the mode that we operate in here in our program. Okay, we've got an obstacle and a barrier, we're going to move forward. So we had been planning based on the messaging that the Attorney General's office was giving us this year that we could have really large impactful cuts. So I'm really fortunate to have the community partner, Molly Mcmath with Compass, to be able to plan for those losses. We are the only county in the state of Ohio that has 2 rape crisis programs, and we collaborate really well. So we met together throughout the middle part of the year to plan for catastrophic loss. And so we implemented those plans after that email was received. So what that looked like was starting the next week, which would have been the beginning of my grant period. We had to move survivors who were on insurance to bill their insurance for counseling. And so what that looked like was contacting each survivor and letting them know the changes. I felt it was ethically necessary to let them know about the changes with the grants and how their insurance would be billed. For those that don't have insurance, our intake department automatically applies them for Medicaid, which is a huge benefit. Or if they're not eligible for Medicaid, we can do board funding, or we have another grant that can cover them. So their services through counseling should still be either no cost because of their insurance, or very low cost, or no cost at all through a grant. So we kind of created a system in which counseling could move on, and survivors are not going to feel the impact of the loss. That was our main goal Molly and I had, was survivors should not be responsible for taking on this loss. And so that's really the only area that changed. My coworker and I, who are part-time in the program, reduced our hours in the program, but survivors are not going to notice that either, because we're still going to be able to devote a lot of time to the program. And in terms of advocacy, we're still doing telephone advocacy at our hospital. All advocacy is no charge, and outreach and community trainings right now are no charge. So that's not a problem. And we've been applying for and receiving other grant funds. So we've kind of shifted from being so Voca focused to, okay, what are some new opportunities, new partnerships we can pursue, and how can we maybe go more local for our funding? And what can that look like, kind of partnering locally with the businesses and our community here for funding? So that's a little bit about how we've pivoted and been able to move forward from the day we got that email.
Thank you so much. Never easy, right? Receiving those emails. And even though we forecasted and we assumed the cut, we never saw it to be at the magnitude, because we are at the higher upper end, right, of those cuts. So it does affect, and those numbers are more than numbers. Each number, each dollar, it's actually a survivor. It's actually programmatic. It's services. It's staff as well within the services that we provide. Molly, tell us how have the Voca cuts actually affected your programming, also the other areas of Tuscarawas County and Starks that you actually serve as well?
So again, with Gina, we've been having these conversations for months now, and we were trying to be as prepared as we could. But obviously, when the actual numbers got sent out, it still was quite shocking to see those numbers and right there in front of you. And so we want to try to maintain the best services that we can for our survivors, and the ones that are the most necessary. And so we had to make some difficult decisions at Compass. One was we let our case management program kind of dissolve into just our day-to-day advocacy. That did require a layoff, unfortunately. We also had one of our campus advocates resign just around the time that the Voca cuts were coming. And so we chose at this time not to rehire that position. And we still had another campus advocate on staff who absorbed that campus work, but it also has limited our capacity now. You know, we still have more campuses that we could be doing more work on. But right now, our capacity is very limited with that. And, you know, just I think everyone here on this call can say the remaining staff have to take on more responsibility. You know, their jobs are kind of being stretched now. And I think that's a fear that I have too. You know, we are always worried about making sure that our survivors are receiving the services they need. But we also have to be mindful of, are they receiving those services from well-rested staff and who have been able to stay on the forefront of best practices and trainings? And I think now we're all thinking, staff don't have time to go to trainings. Like, we're just trying to provide the services at this point with the staff that are remaining. And so I think it's just another really big concern that we have here in the territory that I serve anyways. I think overall, when we talk about what the needs are, we have seen an uptick in our crisis calls during this year. We also have seen an increase in the number of counseling sessions that we have offered this year. And so when we look at those services increasing, but our funding decreasing, it's a concern. It's a concern. How do we continue to meet those needs?
Thank you. Most definitely a concern. Kathy, you have a dual agency, right? And have been in the Richmond area for a very long time. Starting off with a shelter, and it's all victims of crime, right? So it's domestic violence, sexual assault programs that have been affected, counseling, youth programs, elder, our CACs. Tell us about that impact on that duality of agency that has affected with the Voca cuts, and what have you done to actually build some resiliency or cross-train staff or ensure that you're still able to cover both bases?
Okay, we're like most of the programs. We saw this coming. I mean, we were told it was coming. So to not prepare, I think, would have been a mistake on our part. So we started thinking more than a year ago how reduction in funds would affect us. So actually, a couple of years ago, our board put together a really aggressive strategic plan to help us diversify our funds. As happy as we were that we got a huge increase in Voca 6 years ago, right? We were so ecstatic about that. We knew that there might be a day that it would go away. And best practices for our program meant that we started looking, even in the midst of plenty, for diversifying funds. So we started doing that a couple of years ago, and started thinking about what would we do if we had a reduction in Voca funds. So we were able to hire a development director and start looking at that. But also, we're kind of like Molly's program. We had a few people who left the program earlier this year to go to school. One moved out of the area. So when they left the program, we didn't fill those positions. And someone else left during COVID because they found a job closer to home. So those were 3 full-time positions that we didn't fill because we knew that funding cuts would be coming. we also had a full-time campus advocate that was located on our OSU regional campus, and that full-time position went away. We absorbed that into current staff. So another full-time responsibility absorbed with current staff. And then we did have to let go of a few folks also. So we lost about 5 full-time positions and 2 to 3 part-time positions in our program. But the good thing is that by cross-training all staff to respond to our dual agency really helped us to help our sexual assault program and provide, like I said, some resilience there so that the same few people weren't on call 24/7 every day of the week and weekends. So that's been really, really helpful to us. And I don't know if we didn't do that, what we would do. And I was thinking when everybody else was talking about the kind of people who do this work, right? We're not going to let survivors suffer. We're going to take care of those people who call on us. So we're going to make sure that the calls are answered no matter what time, day or night. We're going to make sure that somebody has court accompaniment. We're going to make sure that when there's a crisis that we're going to answer those calls, no matter how many staff members we have. So whether we have 30 or whether we have 3, we're going to take care of those folks. And I just want to make sure that we're taking care of our staff so that when they're that committed to survivors, that we're that committed to them. So whatever we have to do to make that happen, that's what I'm committed to as well.
Appreciate you mentioning that. Gina Patterson, tell us a little bit more about your program. How many survivors did you actually serve in 2019? And now in the midst of COVID, and how has these cuts continue to affect the way that you actually provide services? And Gina, thank you for joining us, Power. I know that you have to go see a client.
Go serve those victims. So yeah, we serve over 500 a year in our advocacy program between Wayne and Holmes counties. And so that's victims of both domestic violence and sexual assault receiving legal advocacy, court accompaniment, assistance with protection orders, those kinds of things. And in our shelter, we usually have over 100 adults and anywhere from 50 to 60 children every year. And we have an open-ended stay in our shelter. We don't restrict it to 30 days or 90 days. And so, people can stay any length of time there. And, where we're going to feel the impact of Voca the most, our budget was cut by 1/3. And most of that was personnel. I mean, there weren't many extras in there. One of the extras that I cut, which makes me sick to think of it as an extra, was we had some funding for what we called alternative therapies. We all know that trauma survivors need things to heal besides talk therapy, things like art therapy and music. And we even have a therapist studying equine therapy. And so we used a little bit of Voca money to be able to bring an art therapist into the shelter a couple times a month, and just to do healing activities with our survivors. And that was one of the things that we cut because we saw it as a luxury. And that should not be seen as a luxury. That should be seen as something that every survivor needs to holistically heal. The main way that the cuts are going to affect us is through the increase in Voca funding that Kathy was talking about over the 6 years. We were able to add to an additional staff member at the shelter during peak times. Because we have a 44-bed shelter and we are often at close to 40 people in the shelter. That's a lot of people. And the hotline rings at the shelter too. And so we did remove the second person. Now, we have not had to do layoffs yet. We are looking very much for other funding to try to keep those people on staff. Right now through the CARES Act, we're able to keep one on there, and we're pursuing all different types of funding to keep that. But if we have to go back to one person on shift, I don't know how to advise staff. Over the summer, we had a woman in the shelter with 9 children, and one of those children had special needs. And so if that staff member is helping that mother, rein in 9 children, I wouldn't know how to do that. Maybe comfort somebody who got upsetting news at the shelter. And then imagine the hotline is ringing. And maybe that's a sexual assault victim who just got up the courage to call. Maybe they were just sexually assaulted and they decided they're going to call the hotline and find out how to report it. And our shelter worker has to decide, do I comfort the person in front of me who's crying? Do I help the woman with 9 children? Or do I go answer that hotline call? And let's say that worker decides, well, maybe the hotline person will call back. I'll deal with what's in front of me. And that survivor lets that phone ring 10, 15 times. They don't get an answer. They feel unheard. They feel unlistened to, and they decide not to report that sexual assault. They don't get the help they need. We don't get the possibility of catching a perpetrator so that they don't perpetrate again, because we all know that both domestic violence and sexual violence perpetrators are serial perpetrators, and we're just going to have more victims if we're not able to assist with prosecution in that way or reporting it. So that's what I think about, is what's going to happen. As Kathy has always said, yes, we're going to do everything we can to serve survivors. But I know that if we have to decrease staff, there's going to be some people who fall through the cracks. Through the increase in Voca funding over the years, we were finally at a staffing level where not everybody was completely stressed out. We could breathe, we could serve people, and it's now going to go back to being stretched thin. Having to prioritize, victim advocates maybe spending less time with people, kind of hurrying things along so they can serve more survivors. That's what I'm afraid of that's going to happen next. And I also realized the trickle effect. I was in a community meeting right after we heard about the Voca funding cuts, and there was a police chief of one of the small villages in our areas in that meeting. And when he heard that we had cuts and the Child Advocacy Center in our county had cuts as well, he was very concerned about that. He said that affects the work that they do as law enforcement officers when we're able to help the victims, and that's actually going to put more on law enforcement. And prosecution has shared that with us as well, that when we're able to work with victims, they're often able to participate in prosecution better again, because if we don't get offenders off the street, our work is just going to continue to increase. So I didn't realize until I shared that in the community meeting that this doesn't just affect victim service agencies. This has a trickle effect to law enforcement, emergency departments, and hospitals that might already be overwhelmed with COVID, prosecution. So it's not just self-serving that, we got cuts and we're going to have to do this. This affects entire communities and the well-being of entire communities.
Yes, it is. It is a trickle effect, right? So even understanding those dynamics, and when you're working within your community in a multifaceted format, whether it is through SART coordination or multidiscipline, and you're coming together to try to find solutions for survivors or victims of crime within your area, it does affect us all, right? I heard, Molly, a lot as you were all introducing yourselves, right? People falling from the cracks, but also knowing that your staff is going to be cut thin, right? And that consistency of how can we do this work with a trauma-informed lens and a survivor lens when you are exhausted, when your caseload is too much, when you're trying to work a crisis in the midst of a crisis, right? Because we still have been showing up. How do you have those conversations with the staff, Molly, and how are you able to distribute? The other question that I will have for all of you that I would like us to respond, I heard a lot about campus advocates being cut. That's huge. And all of your areas are with 2 or 3 colleges and universities. And even though students might be connecting virtually or everything is going with COVID, sexual assault within the campuses is still occurring. And that is so worrisome, right? In understanding those. But tell us a little bit more, Molly, about how can we do this work, right? Without stretching so thin, our staff having it with a trauma-informed lens, or what is going to fall through the cracks?
So I have tried to be honest with my staff on what's going on. We have looked at each staff position, what the responsibilities are, how we can move some of that around. We have told our staff as the months progress, responsibilities might change. What you were doing on a daily basis back in February is probably not going to look the same as what you're going to be doing this coming February. And I think we all need a little bit of time to kind of get used to what this new funding situation looks like and how we continue to meet the needs of our communities. And I just think one of the things is just so important is trying to still build that team mentality in our staff. And again, it's hard because we were just talking about earlier this morning, all of us here on this call, we miss meeting in person. We miss being able to just get to build that team amongst ourselves from our in-person meetings that we used to have. And I know at our agency, most of our staff meetings are virtual meetings like this. And so it's going to be a challenge to continue to build that team mentality and have that team effort when this is the time that we need it the most, right? I think we're going to have to really not only work as a team within our agencies, but as Gina was saying, with our community partners as well. I've been trying to have a lot of conversations with our community partners, our advocates at the prosecutor's office and our child advocacy center and, with the hospitals and our SANE departments. We're going to have to kind of think outside the box and help each other. That's really the key of, I think, getting through this and making sure that survivors are not slipping through the cracks.
Thank you. And Kathy, you mentioned about being strategic, right? And that your board was very aggressive in knowing that this overflow of funding was not going to last forever. Give us some tips, recommendations that you would have, because everybody is stretched in reference to funding. I know that getting that development person probably helps in seeking out additional funding, but how can the community be involved and also as individual agencies, us understanding how to seek additional fundings or sources or ensuring with the ask that the needs of survivors are being met, even in the midst of these Voca cuts?
Well, I think right now a lot of community agencies, a lot of funding programs, whether it be your foundation or your county governments who are getting CARES Act money, they're releasing more money for programs who are struggling. So tapping into those programs and making sure that we're accessing them whenever we can. But a while back, we were blessed with a donation from somebody who passed away, and instead of using that money for something, we leveraged that money to approach our county foundation about hiring a development director. So we said, if we can put this much into the program, can you put the other portion? And I wouldn't have thought of that normally, but we all attend community meetings all the time, right? So networking with the community, seeing what the community is doing is really important because they might have ideas that we don't think about. So somebody else had done something similar. So I'm like, because I didn't think our program would be able to afford a development director. If we were doing that all by ourselves, certainly we would not be able to afford that position. It's not grant funded, right? So, 100%, well, probably 97% of our staff are grant funded. So trying to hire somebody that we can pay for without a grant is not a luxury that we generally have. So that was something that we were able to do, partner with the community to hire that development director. And since COVID happened, then the urgency became just so intense. Now we need to raise more money. And how do we do that? So we have a really good development director that thinks outside the box, and we're just doing all kinds of fundraisers, whether they're small or bigger, just to get folks engaged and, let them know that there's a need in the community. And it is a community need. This isn't, we don't operate, none of our programs operate in a bubble. We are all part of teams, just like Gina said, prosecution, law enforcement, the hospital systems. And without one of these programs, the process falls apart. So letting the community know what the needs are is vital. And especially right now, I think that if the community knows that you have a need related to COVID, you can get support for that. So I would just encourage everyone to continue talking to their county commissioners and their city development folks, and making sure that if there are funds available for a program, that we're tapping into all of that as much as possible.
Thank you so much. And how many people do you serve in your area, Kathy? Both DV and SV.
So we serve probably around 500 folks in both programs when we include the advocacy and support to our support group programs, to the crisis hotline, the shelter, and to the sexual assault survivors, campus survivors. Our hospital system, we have 3 sites for one hospital, 1 site for another. So we're responding to 4 different hospital sites as well.
Thank you. Molly, has sexual violence, interpersonal violence, DV, stopped occurring in the midst of COVID?
No. I think that what we saw, it changed a little, so obviously I'm just speaking for myself, but I think the others will probably agree that we saw a decrease in hospital advocacy there for a while. And even now for us, our hospital advocacy numbers aren't as high as a typical year would have been. However, like I said earlier, our hotline calls are going up. People are calling. During the shutdown, a lot of our services kind of fell quiet for a little bit because people couldn't leave their homes. And if your home is the place that's not safe, how do you access services? And so the abuse wasn't stopping. It was just they had a barrier to reaching out and getting those services that they needed. Now we're seeing they're coming back. They're reaching back out now, wanting services. Our police interviews are going up as they're kind of catching up on cases, and more people are reporting now. Our advocacy at the police stations are increasing. Our number of counseling sessions has greatly increased this year. We had to, for the first time, start offering telehealth services for our counseling program. And we had never done that before. And we were kind of thrown into it very quickly, and we've adapted, but we have found that that really helped a lot of survivors that couldn't leave their homes or didn't feel safe leaving. It gave them the opportunity to still continue to receive those services. And so our numbers for the counseling services have, really gone up as well. So I think services look maybe a little bit different in the midst of COVID, but they're still reporting, abuse is still happening, and survivors still need services.
Thank you. Gina, how do you envision carrying through the remainder of this year and the rest of the grand year 2021 with these Voca cuts, right? And also the increase of cases with COVID. Like here in Cuyahoga County, right, where they're watching us continuously because unfortunately we are at a purple alert, going on to red and going back and forth. But in the last 21 days, we have not been able to mitigate the numbers, right? So there are huge conversations of another shutdown or what it's going to look like. And we're still providing services, right? So there was a shutdown, but we never closed. We were always working, whether it was from home, here in the office. We never closed our doors and providing services and connecting. But are you able, Gina, to envision for your 180 programs and for the survivors in your areas a different way of providing advocacy in the midst of COVID and with these cuts?
Yes. So similar to Molly, we also began offering services through telehealth, like Zoom or some other platforms right away. So we never closed our doors, both to our main office where our advocates are, both in Worcester and in Millersburg, and our shelter. We've never closed our doors, but we did want to offer services via telehealth for those who, it was safer for them to have services in a virtual manner. So we'll continue to do that. And as a behavioral health organization, we want to do follow whatever we can to get the certification to continue providing telehealth services long term, because it is another way to reach people. What our victim advocates have told us is they are seeing an increase in the level of violence. They have not experienced survivors telling them how violent their abuser is being. They're seeing more black eyes, more broken bones, more reasons to go to the emergency room for injuries than they have. And our advocates have been with us for many, many years. So it's not like they've been here 2 years and they don't have a lot to compare it to. One advocate has been with us, I know, since 2008. So that's 12 years of experience, and others, not long after her. So they have a lot to compare this to. So, and they are trying to do a hybrid of both in person and virtually, trying to, keep everyone, safe. But I've seen my one victim advocate, in a big room with a survivor and multiple children running around, and 2 laptops and masks, trying to complete protection orders. And I walked by a room the other day that she was in, and there was a tiny little pair of shoes. And mother had gotten overwhelmed with the protection order process. For those of you who don't know, you have to write a victim impact statement. So you have to be able to write out everything that has happened so that you can try to get some protection. And it became overwhelming, and she fled and left the little boy's shoes behind. So that's what we're seeing, because there's so much intense emotion around COVID and the pandemic and how it's affecting everybody. It's heightened all emotions and made everything more difficult. And as Molly and Kathy have said, I'm concerned about staff too. I mean, because the effects of the pandemic on them and their personal lives, and are people going to get more burnout? So Rosa, you asked how do I envision getting through the rest of this year and the rest of the grant year? One day at a time. That's the only way I know how to do it, is one day at a time.
Thank you. Kathy, how do you envision with the cuts? And I know that you've found other ways, but can programs truly be sustainable if the cuts continue to be at this level?
No. If cuts continue at this level, we will not be able to continue to provide the quality services that we provide. And I think that's what all of us pride ourselves in doing. You know, we provide a vital service to our community. Nobody wants their loved one to experience domestic violence or sexual violence and not have resources to assist them. These are the worst things that could happen to people. And to navigate our systems without support would be devastating to individuals and to the community. So we can't continue operating at this level. And frankly, the community, our communities, our state and our federal government shouldn't want us to either. I'm surprised that we are even having these conversations when this is going to sound harsh, I know, and maybe draw some criticism, but when sports stars make millions of dollars a year, and many of them do donate back to their communities, and I'm happy about that, but our priorities seem to be mixed up sometimes. You know, we're funding the wrong programs, and when people in our community are suffering and dying at the hands of their abusers, and we are struggling, our programs are struggling every day just to survive. So I'm really inspired by my partners in this work. A few weeks ago, someone in a neighboring program called and said, "Hey, how you doing? Do you need any help?" You know, they're much smaller than we are. Their staff is much smaller than ours. But just getting that call saying, anything that you need, we're here to help you. So we're surviving by the strength of this community, so which I'm very grateful for, and really appreciate. I appreciate the Ohio Alliance, especially. Rosa has been on this since before the announcement, so I appreciate the work that the state coalition is doing, has been doing, and continues to do to make sure that not only our programs are funded, but that survivors are being provided the services that they need. So thank you to Rosa and the rest of the staff for making sure that our voices don't fall silent to those in a position to help us.
Thank you, Kathy. We strongly do believe that there is strength in collaboration, right? And there is strength and power when we come together and we are able to embrace our voices, and the community is able to hear the great services that are provided and be part of the solution and not the problem. Molly, as we're closing out and then giving it to Camille, because this is not just a statewide problem, right? This is a national problem. All of our coalitions, over 156 programs did not get funded this year, new programs, and then over another 170 programs got a cut anywhere from 33% to even 55.5%, especially in the Northeast region. When we look at how vast, right, the region is and large and how many programs, the cut is huge in comparison. If you had something to tell your legislators or your community partners, what would it be, Molly?
I think that it's so important to understand, yes, we lost a big chunk of money this year, But the real concern that I have is Voca was a consistent funding source for all of these programs year after year. We didn't have to create any new program. We could just go back and ask for Voca funding to continue funding the programs that existed. And so this year we have this huge cut, and we're all kind of scrambling to try to find additional funding to fill that gap for right now. But next year we could be looking at the same problem or bigger if action isn't taken. And it's going to be very difficult for all of these programs to continue to go year after year to the same foundations, asking for money to fund programs that are in existence. We're not asking for new new purchases or anything new, just fund what's in existence. And that's a hard ask. And it's going to be very difficult to ask for it year after year. And so we really need to restore Voca funding. We need the state to help in this funding so that we don't have to recreate the wheel every year. We can just get funding to maintain what we have each determined is a necessity in our communities. And we're not, like Gina had said, this is a collaboration. It's DV shelters, rape crisis centers, child advocacy centers, prosecutor-based advocates. We're all a system together. We all work together, and we all need the support, and we all need the help. And so, to our community members, if there is a mission that is near and dear to your heart, help them out. Help them out right now. If you can do it financially, that's great. If you can't do it financially, call and ask if there's something else you can do, because all of these programs are hurting, and we all need to be present in the community for the system to work. And so if you help one, you're kind of helping all of us. So whatever you can do, we need everyone to be helping us right now.
Thank you. Camille, what can we do strategically?
Yes. So I'm so glad, Molly, that you brought up the conundrum that is applying for grant funding. So as we're looking at diversifying funding, I think it's imperative that we examine the structure of how those programs and applications are communicating their requests for proposals. And this is a bigger strategy over a longer period of time, but we need to remind our potential funders that something does not have to be brand new to be worthy of funding. And it's a simple sustainability issue. To continue funding services that have been deemed essential and need to exist is not in some way less valid than funding a newer project. And so for those of you who are viewing this that aren't as familiar, let's say that Molly's program, for example, has 4 advocates, we'll say. I know that that is not your staffing structure, but let's say that Molly has 4 advocates at her program. And in order to maintain salaries after a cut, she has to apply for a new grant, and they want to see something new. So she has to add additional duties onto the people who are already working there, struggling to serve survivors, just to make sure that they get a paycheck. So over time, you end up adding additional layers of responsibility instead of adding additional staff. When you are not facing cuts, you do have more of a freedom, we'll say, to apply for funding that allows you to add a person to do the work that you're saying you're going to do. But, a lot of us are just trying to save the positions that we have at this point. And so I think a larger conversation with community partners as often as you can about why is that the review approach? How do we modify how folks are reviewing grant applications in the long term to make sure that we are not creating unachievable goals and exhausting systems and exhausting nonprofits. So I think that's a big issue. The other thing that you all talked about today that really speaks to my own experience is that secondary trauma is real, and that the folks, like you have all said, no one is going to let a survivor not get served. And so what does that mean for the person who's employed in that position? Does that mean that they're working an amount of unpaid overtime that is not allowing them to sleep, that is not allowing them to eat, exercise, maintain any sort of work-life balance? But beyond that, we value the people that work for us and provide these essential services, and I don't think we can say that enough. But if, like to Molly's point, if you're not well rested, you might not be providing the best information. You might become so exhausted that you engage in potentially unethical behavior because you are spread so thin. And that's just human nature. That's not an advocate specific problem. That survivors are not getting the services that they need. I mean, we're seeing more wait lists pop up. We're seeing more requests for services. The longer you're staying on the phone with a survivor, the less time you have to spend on the phone with another survivor. So I think we need to get back to, and this is a lot of consistent communication with federal lawmakers, but Voca needs to be restored. And there's really only one way to do that, and that is to pursue cases to prosecution for white collar crime and to re-up the deposits into the Crime Victims Fund. Molly said it's a year after year after year thing that's been stable and consistent. I call it a government partner. I don't consider this a grant fund. I consider it a government partnership with nonprofits that has been in place quite literally my entire life. And so this money has been distributed, created domestic violence, rape crisis, child advocacy programming the way that we know it to be, because they identified best practices and put not taxpayer, but government funding into those structures. And now they're pulling that out and saying, we know this needs to happen, but you're all just going to have to burn yourselves out doing it. So it's constant communication about how valid this is, how important this is, because, to Kathy's point too, nobody wants to face this without advocacy. And I have a suspicion that, we make a lot of assumptions about what is going to be available should we ever need it, should a tragedy befall us in our life, but we don't research what that is before the tragedy happens. So my understanding, based on working in this field, is that people assume that there are resources. People assume that there is advocacy. People assume that there is going to be someone somewhere to provide them with support. And when that is not the case, more and more people are going to realize we need to have this funding. I don't want to wait until that collective realization happens. I want Congress and I want, the executive branch to really support this. So while we will do our due diligence, because we all know that funding is scarce for everything, and like you've all said, we were warned about cuts. We were planning for this. We can plan all we want, but our population in the United States is going to be much better off if we're here to serve victims, and we need to be constantly communicating that. So we should know in about a week, hope a week, who our representatives and senators are going to be after the election, and it's time to start reaching out to them. So when you know who your representative in the U.S. Congress is, who your senator is, then it's time to start calling, leaving messages, sending emails, and saying this victim service must be restored to its prior levels. And we will keep working with the State House. We're engaged in a lot of work at that level to increase state level funding for this as well, but that's going to keep our doors open until the federal government can re-up. And just to remind everyone, we talk about the federal government as though it's this distant thing. They are accountable to us too. We are their constituents. We are a collective constituency. So, conversations are important. Communication is important, because nobody wants to live in a world where our services don't exist.
Thank you. I appreciate each and every one of you for joining us early this morning in this critical conversation. Once again, the time is now Ohio. So for those of you that are wondering what to do, pick up those phones, send a letter, send a text, but also write a check. Go on to each of these agencies' website, make a donation, understand that survivors within your communities need the services of these nonprofit, of our agencies, in order to navigate systems in the most traumatic stage of their life right now. If these programs do not exist, not only would there not be prosecution, convictions, but there would not be a process of healing. And we are here to empower survivors to find whatever healing process they want, right? And to have them regain again their voices. So time is now, Ohio. We need you now. Go ahead, make your donations. Go ahead and raise your voices. Go ahead and embrace the voices, and know that survivors need to be believed, supported, and the agencies doing the work as well. So thank you for joining us today, and we shall continue with our critical conversations. We are stronger together.